This morning we discussed the role of novel imaging techniques in multiple myeloma, going through the fact that whole body X-ray has a really small place now in this disease because it is frequently underestimating bone disease, which is one of the main complications of multiple myeloma. So we discussed the potential capability of whole body low dose CT, PET-CT and MRI to address all the important issues in myeloma. So to use these techniques for the staging, to use this technique as a prognosticator of outcomes and as techniques to evaluate the metabolic response to therapy. And what we discussed was the fact that regarding the staging, it's very difficult to make a clear recommendation because usually the choice of either of this technique is linked to the expertise and to the resources of different centers. However, there is a strong recommendation to use one of these three novel imaging techniques because otherwise you are really underestimating the burden of the disease. As far as the evaluation of response is concerned, there is a strong recommendation to use either PET-CT or functional MRI, that is to say diffusion-weighted or dynamic contrast enhanced. And we discussed the importance of evaluating also response to therapy outside the bone marrow with one of these techniques. And not only with the usual laboratory or bone marrow test. So this was the main point. Of course, there are still several open issues to be addressed, and this will be the job of upcoming prospective clinical trials incorporating systematically novel imaging techniques together with very sensitive bone marrow techniques. And to my opinion, the most important goal will be to achieve a consensus of how to integrate the imaging response with the bone marrow response in order to produce a recommendation for patients.